Hello, I'm Dr. Sushruta. I'm a breast oncoplastic surgeon and surgical oncologist at Cytecare Hospital, Sri
Become very common nowadays. Many of people are not aware of the problem till it goes to a very advanced stage.
The common or signs of breast cancer: a lump in the breast or in the armpit, the nipple getting pulled inwards. Or how did you actually detect your lump in the breast or cancer?
I just noticed a dimple on under the armpit on the left side.
What would you like to say to the women who are afraid of going for the screening of breasts?
Closing your eyes and walking on the road, not bothering what is there on the road, whether the pit is there, down is there. It's better to keep the eyes open and see the pit and adjust.
Correct.
Don't fall into pit.
Breast cancer, breast awareness in itself today can save lives tomorrow. Today, I take immense pride and pleasure to introduce all of you to my patient, or I would rather say my friend now, Mrs. Uma. She is a scientist, a homemaker, a mother, a yoga practitioner, a fitness enthusiast, and a bonsai hobbyist. And last but not the least, she is a breast cancer survivor and a warrior. Yes.
Thank you. So what is your advice for women in general to have an awareness of this one? At least in my case, I had a family doctor, and just for ordinary daily consultation for fever, cold for my children, I used to go there. So she had taught me how to look for the problem, maybe some 3-4 years back.
Right.
So that awareness, if people are given, it will be good.
So breast cancer or breast awareness in itself today can save lives tomorrow. So what we are talking about today is breast cancer or breast awareness. Be aware of your body. Like Mrs. Uma asked me what to look for. The common symptoms or signs of breast cancer are usually a lump in the breast or in the armpit, any swelling, redness or dimpling in the skin, the nipple getting pulled inwards, or any nipple discharge, and sometimes pain. Most of the breast cancer, to start with in the early stage, are painless, like Mrs. Uma has experienced. How did you actually detect your lump in the breast or cancer?
Last end of August, I just noticed a dimple under the armpit on the left side, and I thought it may be something. Let me just watch. I watched for about 3-4 days. I came to the reception and asked for consultation, and they gave me Dr. Sushruta's number, and then followed series of tests, and I just wanted to make sure whether it is a benign one or a really this one.
It is as simple as Mrs. Uma here is mentioning. She just took 3 to 4 days to realize she needs a consult with a doctor, which is the first and most important step every person who notices a lump in the breast has to do. Visit a doctor, and then the doctor will take you through the test to confirm if it is cancer or not. Most important and a little difficult on the part of a clinician like me and for the patient you are. So what were your initial thoughts and feelings when you first received the diagnosis of cancer?
See, after the diagnosis, so many tests were done and it was confirmed that it is positive. My first thought was, let it go. Anyway, considering my age, I said, I'm already 76. I should not bother, it's just a matter of time, let it go. But then you persuaded me that it is not like that. See, this is something which should not happen in age, but if it happens, when the thing was, say, like BP, diabetes, heart problem, this is also one of the things. Okay, let it go. Let me not bother much about that. Then after your persuasion, I just decided to go through the surgery and the post-surgery treatments.
It is like any other disease which has a cure once it is detected in its early stages. So, as she already mentioned, like any other disease, cancer is not the end of everything. it has its treatments, and the treatments are very well advanced to cure the patient of the disease. So patients often ask how the whole treatment process is going to affect their work life, family life, the workouts, or their health, or their daily routine. So I always tell most of my patients not to quit their job if they are in. Even otherwise, to continue their daily activities in the same manner as they used to the day before to their diagnosis. And thanks to all the advanced treatments, most of my patients are able to do this.
See, after the diagnosis, so many questions, so many doubts arise in the mind. Not only for me, I'm sure every other lady also will be facing that. Yes. See, the questions, common questions are how long I have to take the treatment, whether I will have a hair loss, and how it affects my other things, what are the side effects, how it affects my daily routine. So these are the doubts, fears that arise. So what is your advice for
all the patients come with so many questions in their mind about how long the treatment is, what could the side effects be of all the treatment modalities, or how it is going to affect them. Yes, a very appropriate and a good question to ask. And this varies from patient to patient because breast cancer is not treated as a disease. Every patient gets a personalized treatment depending on the various tests done. So we are going to counsel the patient depending on the treatment they are going to be subjected to. So as we all know, surgeries these days have been highly advanced, and patients can undergo daycare surgeries. And chemotherapy, yes, there could be hair loss, but the hair comes back to the normal as it was before the treatment. With radiation also, there are very minimal side effects, along with hormonal therapy, which are just few tablets given to prevent the recurrence of the disease. Coming to the psychological and emotional component, which most of the cancer diseases largely bear. So what was the reaction from your family end when you disclosed the diagnosis? And what is the kind of support you looked for or you received once you were actually diagnosed with cancer?
Actually, in my case, both my children are away.
Yes.
So I didn't alarm them saying that I'm going through these tests and other things. I just made sure that it is really a case which requires some attention. It's like that. It so happened that my daughter was here, and I requested for the surgery just when she was there. Right. So she was there for 3-4 days, and again she came back. There was a gap, I had to travel somewhere, then I went through the radiation. Again she was there for 1 week, and that was a good support. Right. Initially I didn't want to alarm them, but anyway, it just happened. And my other relations awareness, see, I have come across this problem, my own sister, and another 3-4 cases, not exactly my blood relations, but related to me. See, one lady was in her 60s, and the other lady was in her 70s. And one more case, very unusual case, my nephew's wife was just around 40, small children. And she fought life so bravely. And then I heard later on that she was giving counseling to other members also.
Just like you.
And now she will be in 60s. So she had in her 40s. So I have come across or had seen all these things, and it's quite a common thing now. There is no alarming reaction from other members. They know that I can fight it.
Correct. So Mrs. Uma has been absolutely very brave, and sometimes, every time actually I should say, she has amused me. All my patients are amazing, and they amuse us doctors in one or the other way. But every time I have seen Uma, be it after her surgery or during the rest of her treatment, she never fails to amuse me, because the courage and the resilience she carries with her is something I always look forward to when I meet her. Most of the patients diagnosed with breast cancer usually have a lot of questions to the doctor, and more than the doctor saying something, I think patients are more receptive and want to know what is the real experience of a person who has actually undergone this treatment. So, Mrs. Uma, I would like to ask you, what is your advice to the patient who has just been diagnosed with breast cancer?
See, this is something which nobody should get. But if it has come already, there's no point in getting stressed out or getting depressed or like that.
Agreed.
See, for a working woman and a non-working woman homemaker, the challenges and demands are different. People at home mostly spend their time watching TV. See, that is totally a digital world. So apart from videos and movies and cinemas and serials, you should develop a hobby where your hands and eyes and mind are focused. Like that, it could be sewing, painting, gardening, knitting. There are a whole lot of things which has been pushed under the carpet. So my advice for people is to have some analog apart from the digital world.
Very well said, Mrs. Uma. Yes.
See, is breast cancer hereditary? So I am diagnosed. Is it that my daughter also is 100% probability of getting the cancer?
So the most important point I would like to emphasize here is only 5 to 10% of breast cancers are hereditary. 90% of the breast cancers occur without any family history of breast cancer. I want to know the probability of your daughter being tested with the same. So yes, because she is your first degree relative, her risk of breast cancer is slightly higher than the rest of the general population. So for this, we have some genetic tests which can be carried on you, and if you are tested positive, we'll also do it for your daughter, and then that will have implications. But if it is negative, it means she is of the same risk as because of your history of breast cancer.
I was not aware of that.
So we have almost come to the end of the conversation, where I would like to ask you, how has this whole treatment journey changed your outlook towards life?
Since I've diagnosed and started my treatment, and except for the days I come for radiation therapy or surgery or something, I have not missed any of my routine.
Mrs. Uma, who, or rather I would say, what gave you the strength during the whole treatment process?
76 years I have faced many challenges, whether my younger age health issues or my college or office or whatever. So many different issues came up. So maybe this is also one of them. I have sailed over many of these problems.
Hurdles, yes.
So this is also one of them, I feel. See, my father always used to say one quote, ಬಂದದ್ದೆಲ್ಲ ಬರಲಿ ಗೋವಿಂದನ ದಯೊಂದಿರಲಿ ಅಂತ ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ರು ಯಾವಾಗಲೂ.
Correct.
So I always remember that.
Nothing about her outlook towards her life has changed. Her roles, her daily activities, her routines, her hobbies, nothing has been changed or has gotten affected by this whole process. And this is what just amazes me about Mrs. Uma and makes me strive all the more to do better and give similar outcomes to all my patients alike. So entirely throughout the conversation, what I've been trying to throw light on is early detection today can save lives tomorrow, and not just the life, we can also preserve the breast. Cure rates are as high as 90 to 95% in the earliest stages of breast cancer, and this can only be done by what is known as screening. Screening is imaging in those women who are absolutely asymptomatic or have no signs whatsoever of breast cancer. So this is done by breast self-examination, clinical examination, and mammogram. Mammogram starting at the age of 40 years. What would like to say to the women who are afraid of going for the screening of breasts?
See, this my advice is, instead of, it's like closing your eyes and walking on the road, not bothering what is there on the road, whether it's a pit is there, down is there. It's
That's
better to keep the eyes open and see the pit and adjust.
Correct.
Don't fall into pit by closing your eyes.
Well-
That's all I want to say.
As she rightly put it there, and she bluntly said it, we have to take screening to know if there is anything wrong, and we should be able to fix it and cure it when it is possible rather than falling into the pit, as she mentioned. So early detection can save
Yeah.
lives, and breast. Thank you.